WGST.
Welcome back. I'm Ben Chodor, and you're listening to Health Tech Talk, broadcasting live on 640 WGST and streaming worldwide on the iHeartRadio network. So welcome back. I have a great guest for this segment, Michael Serbinis. He is the CEO of LEAGUE. LEAGUE is an incredible digital health and wellness company. Had just closed, or ended last year, closed a nice round of funding. So first, Mike, congratulations and welcome to the show. Tell our audience just a little bit about how you started this company.
Thanks, Ben. It's great to be here. We started LEAGUE in 2014 with this vision about the world of healthcare going through a major transformation, and us wanting to be at the forefront of that, with the idea that we could empower and enable people to stay healthy every day.
All right, that is great, but why healthcare, right? So if you read your bio, I mean, you've built a couple successful companies, you've sold them for incredible amounts of money, you've done stuff in the beginning of your career where NASA was involved, and you built things. How did this road lead you to healthcare?
You know, I'm totally excited by these massive disruption opportunities, and this mantra of thinking bigger is something that I believed in for a long time. So whether it's building a new propulsion system for the space shuttle program, or building one of the first search engines with Elon Musk, or one of the first storage in the cloud type services, publishing service for around the world, and now healthcare. I mean, what could be bigger than transforming healthcare? Thinking bigger is what I get excited about.
All right. So I noticed that you have basically two mantras. One is thinking bigger, and culture is a weapon. So let's start with thinking bigger. What does that mean to you?
For a guy that grew up outside of Toronto in Canada and has traveled the world since, I had this idea of, to really make it in technology, or frankly, most industries, where there's only one, two, maybe three winners on the podium. You got to think globally. You got to think bigger than your city, your state, your country, your continent. You got to think globally, and that's what I've done with every one of my companies.
And do you actually, so for the staff, do you actually, emphasize that to them? Do you want them all to think bigger than they did the day before, bigger than they're going to, every day?
Absolutely. I mean, if I look at my recent companies and now with LEAGUE, this idea that, there will be a transformation. It's going to happen. There's going to be a handful of companies, a handful of disruptors that are on the podium in the end, and every decision has to go through the filter of, does this decision put us on the podium or not? And if not, it may seem like a good idea in the short term, but it's not going to get us where we want to be, so we're not going to do it.
Great. I mean, I love that answer. There's nothing I can even add to that, because I think that is so spot on. And now let's go back to an area that, everyone who's listening to Health Tech Talk really cares about, the digital health and wellness platform, right? So what you guys created, I actually went on the website a couple days ago, and I joined, which is, join
okay,
LEAGUE.
great.
I think it's really cool. I also noticed on the site, you guys take company runs together and you have to wear bright shoes. Is this a truth?
Yeah, we're into eating our own dog food, so to speak, and staying healthy every day is something that we espouse, and if you can't do it yourself, you really can't design the best consumer experience for everybody to do so.
All right, so now I want to jump right into the company. I saw a little fact that you gave me is that we spend nearly $4 trillion, on healthcare, and we need to focus on one number. The 50% of the behavior based is preventable. Sort of obesity, diabetes, which is an epidemic in the U.S. And epidemic almost everywhere else. How does LEAGUE get involved? And when I join LEAGUE, whether I'm a physician or patient, can we start with that side? Why would physicians join, or and patients join, and how does it get involved?
Well, I think everyone that looks at healthcare, knows how big it is, knows how little is spent on prevention, and knows how over the next decade, as the boomers really start to, tax the system, knows that it's going to grow. And so outside of, services being cut or everybody spending a lot more money, there needs to be a different way. And so this idea of starting to shift the model and make, from a consumer standpoint, it easy to use preventative health services, I think that's an inevitability. We're going there. And as far as the service goes, we're signing up all kinds of health professionals as we're in our closed beta period right now, getting ready to launch more broadly. And, this idea that you can join League, you get access to all these people, all these consumers that are like-minded and want to, focus on their health every day versus, show up in the hospital when things are bad. This idea that we make it simpler for the consumer. We surveyed thousands of Americans, and we found that one of the major issues that everyone has with this idea of preventative health is they don't know where to start.
Right.
And those that do find the system more painful than the actual thing they're trying to solve.
So you tell me from your survey. So from your survey you did, I think you said you did about 2,000 Americans, that people are frustrated by the system. And what are some of the key things they're frustrated about?
So discovery is always top of the list. Who should I talk to? Who should I go to? Who's good? Who's close to my home? There's no price transparency. You have no idea as a consumer beyond even if you get a few recommendations in your neighborhood, what things cost. And then the whole logistics of, scheduling, paying, setting up your first time, intake form, which you feel like you've set up, you've filled out that same form like 18 times in your life, and you're in this today's digital age, you're being asked to do it again. All of this is friction. And if you think of how easy it is, I don't know if you're an Uber user, but if you think of how easy it is to order up a cab and pay for that cab and that whole experience, a lot of friction, whether it's a cab or a limo, a lot of friction has been taken out of the system. And whenever that happens, and any one of these disruptions, more consumers pile in. And that's what we're trying to do here, is we're trying to make that friction go away, make it easy to discover, of course, schedule, pay, share information with your health professional. And then on an ongoing way, just like we build out our profiles on LinkedIn or on Facebook, we're building out our health profile so that next professional, that next pro that we deal with, whether it's a physician or nutritionist, knows enough about us to deliver great personalized services. That's incredible.
So what I love about your organization already, right, is you're not just about sign up and we're going to give you exercise and eating tips and staying healthier tips. There is a total engagement with my clinician and my healthcare providers. Everything you mentioned, from scheduling to interaction. So there is a connection.
Yeah, in fact, this idea of increasing engagement is core. It's core to who we are as a company. It's core to the name and where the name League came from. This idea of preventative health, this is something you do every day. And staying closely connected with the people that are in your league, your different health professionals, maybe your family, people that you maybe belong to the gym with, that drives engagement, and that drives, think about it. We spend on average 40 minutes a day, on average, on Facebook. Imagine if you can spend a couple minutes a day on your health.
Well, that'd be incredible. I think everyone should do that, and that's what Health Tech Talk, the show everyone's listening to, is all about. And Obamacare requires insurance plans to start adding preventive resources, right, and services for the consumer. So League basically fits dead in there. It's the ideal technology to use if you're a payer or provider.
Right, yeah, right on. This whole idea is that now insurance plans need to, by mandate, include more preventative care services, whether that's seeing a nutritionist or maybe it's an obesity assessment, which, as you said, I mean, that's become an epidemic in this country, and it's one that needs to be solved. It needs attention. So all of these preventative services are now going to get covered, or a good percentage of them, by insurance. And all these new people are coming on to the system. How do we make it dead simple for them to access, discover, these services, and then, make everything from scheduling, payment, communications,
Mike,
right from your mobile phone.
I got to take a commercial break. I can't wait to get you back on after this break. And I'm Ben Chodor, and you're listening to Health Tech Talk. I'm broadcasting on 640 WGST on the iHeart Radio Network, and we'll be back after these commercial breaks. I want to thank 1-800 Public Relations for all their media and PR help, and for Stream VPG, who's helping us out with production. We'll be right back after these commercial breaks.
If you've got an IRA, 401k, or pension plan, I've got some really bad news for you. The IRS wants you to think these qualified plans are the best way to save for retirement. They give you a tax break when you contribute. Sounds good, right? Wrong. A qualified plan could be a tax disaster when you retire. With $17 trillion in debt, taxes are already going up. Imagine paying a top tax rate of 94% like they did in the 1940s. There is a better way. It's an alternative the ultra-rich use that beats the pants off your IRA or 401k. It's been around for years. Your money grows tax-deferred, has no taxes during retirement, and no income taxes when you die. Plus, you can grow your money potential double digits with no risk of losing money when the market crashes. If the market tanks like 2008, you lose nothing. Call 800-698-2121 now to talk to a specialist and get a free copy of my Inc. magazine best-selling book, Safe Money Millionaire, to protect yourself from taxes and crashes. The next 37 callers get free shipping and handling, no credit card required. Call 800-698-2121. 1-800-698-2121. That's 1-800-698-2121.
What's keeping you from doing the things you love? Arthritis, back pain, everyday stress and worry? Then call now for a free information kit and DVD about a youth-restoring Safe Step walk-in tub. 1-800-900-1347. A Safe Step walk-in tub can change your life for the better, wrapping you in warm, relaxing, soothing comfort to make your aches and pains and worries gently melt away. Safe Step offers more life-changing innovations than any other tub. The warming comfort of a heated seat, the gentle skin-softening caress of the exclusive Micro-Soothe air system, the muscle and joint-relieving power of precisely targeted body and foot-massaging water jets. Safe Step has helped thousands of people feel better, sleep better, and live better, too. Call for your free information kit and DVD about a Safe Step walk-in tub. Call in the next 10 minutes, and you can also receive special limited-time savings of $750. 1-800-900-1347. That's 1-800-900-1347.
Boat Angel is one of the few organizations that works globally, keeping children out of trouble. By producing relevant films and books for young children and teenagers, they've been successful in helping countless young people worldwide. The most amazing thing is that their entire program is funded by the tax-deductible donation of unwanted sailboats, fishing boats, jet skis, and cabin cruisers from people just like you. Boat Angel is the #1 charity processing donated boats, and on average moves the donated items in under 11 days with no cost to the donor. Donate your boat. Why pay marina fees, boat storage, or even repair your broken boat? You can say goodbye to your insurance, title, license fees, and free up space in your garage or backyard. Donate your boat and help Boat Angel help others. Call us, 800-227-2643, or visit us online, boatangel.com. Don't go through the hassle of selling your unwanted watercraft. Donate it today. We also accept vehicle donations.
Join host Ben Chodor every Saturday at 3 p.m. for Health Tech Talk. Technology is changing how healthcare is being delivered. Their special guests will talk about how healthcare, science, and technology are enabling patients the ability to take control of their own health. Join the conversation Saturdays at 3 p.m.
Pay off that mortgage in under half the time. Get out of debt and do it while building wealth at the same time. Learn the quickest way to eliminate all your debts. The proven debt elimination and wealth acceleration system that is used by the largest financial institutions. Hidden Wealth radio host and best-selling author Chuck Oliver will guide you to a secure financial future. Take a powerful first step. Visit MyDebtIntoWealth.com. This system will change your financial future. Eliminate your debt. Build wealth. Visit MyDebtIntoWealth.com.
Bloomberg. The First Word with Ken Pruitt. Monday morning at 5 on Talk Radio 640 WGST.
Welcome back to Health Tech Talk on WGST 640 Radio and the iHeart Radio Network streaming globally. With me is the CEO of League. Mike, welcome back to the show. The first segment was amazing with you. I can't wait to continue and dig a little bit deeper into your organization. One of the things that I noticed and the information that we were talking about is, where do you think wearables and health apps play into this? Do you think it's muddying the waters, or do you think it's going to be a key? And in League, do you take in health data this way too?
Well, I think there's no question that over the next 5 to 10 years, we're all going to start generating a ton of data about ourselves, from wearables, from other health apps, from devices that are embedded in our clothing and containers of food. We're all going to have all this. We're going to have all this data. Most of it today is like, how many steps did you take? Not super useful for a wide variety of different health issues or health providers, but it's going to get more useful. And our take on it is, it's one thing to have it. It's another thing to actually use it, and making it available to your health providers and putting you in control from a privacy and security standpoint. That's the way it needs to get done.
And using your technology, is there a dashboard for me, so as both the clinician side and on the user side, I get to see all my information in one place?
Yeah, think of it like a dashboard meets your LinkedIn profile. It's always evolving. There's always new information being added to it. Maybe information from your wearables or your electronic medical record from different places, all surfaced in one easy-to-use place where you control the privacy and security of who gets access to it.
Okay, we're talking to Mike Serbinis, the CEO of League, and that if you want to join or if you want to find out more about League, go to www.joinleague.com. So, Mike, what else do you want to tell the audience about the organization, and why at this time and this point in healthcare is it so important?
Well, I think what we've seen over the last decade plus is a healthcare system that's continued to get more costly, a healthcare system where, technology dollars have been invested, but it's really gone into, the big institutional, part of the system, hospitals, clinics, et cetera, where we know that the majority of healthcare issues are totally preventable. And so we're going after that space. We're amassing the largest marketplace of health professionals and preventative health services in the world, with the idea that from a touch of your phone, you can connect with a nutritionist or a physiotherapist or whatever you're looking for and make it simple to take care of your health every day.
So you're putting the power in the patient's hand, in the consumer's hand for the first time.
And that's really, exactly, it's turning the model upside down. We're putting the consumer in control. And if you think about it from the professional's perspective, there are about 1 million doctors in the U.S., and we know that there's millions of other health professionals, preventative care professionals, but most of them are not in hospitals. Most of them are small business owners or independents that have never had the technology world focus on them and enable them. And so now we're bringing, these millions of independents that have got great services and offerings together with the consumer in control and being able, with League, to take care of themselves every day.
I think that's brilliant. I mean, if I'm a physician, a clinician, I want to be on League because I want to be able to reach this incredible marketplace, this audience. And if I'm the consumer, the patient, I want to be able to find the best, and I want to be able to find the answers I want when I want. So putting the power in their hands is amazing to me. So here's two questions I got for you. So if you and I were going to, what do you expect to do over the next 12 months? And then when you and I sit down again next year at this time, where do we expect League to be?
So the most exciting milestone coming up is us just getting League launched publicly. Right now we're in a closed beta, trialing with hundreds of professionals, different kinds of professionals across the country. By this time next year, I expect to be widely available in North America and being preparing to roll out in other parts of the world. And, this whole mantra of thinking bigger, it applies here to League as well. While this is a $4 trillion industry in the U.S. and Canada, we're seeing that, it's several multiples of that worldwide. And this is a problem that needs to be solved everywhere.
This is just the start. This is great. All right. I'd be remiss if I don't ask you to give some of our audience advice. I mean, a lot of our audience are investors, healthcare executives, and then also consumers and as well as entrepreneurs. You've done several startups. Is there room in the healthcare space for a startup? And what advice would you give any young entrepreneur out there?
So what I can tell you, having done a bunch of startups, all with successful exits, totaling billions of dollars now, is there's absolutely, some pattern recognition here. For me as an entrepreneur looking at this industry, it checks all the boxes being ripe for disruption. If I look at my last industry, so I was disrupting publishing and the whole book retailing world. When I started, there were hundreds of companies, and I remember going to the Consumer Electronics Show. There was hundreds of e-readers in that space, and we were this little company that no one knew about or cared about. But we said, we're going to be on the podium. We've got a strategy. This is a space that's ripe for disruption. It's going to happen. The same is true here in healthcare, and I think anybody getting into the space right now has a shot. It's open season. There's no mass consumer brand that the healthcare world knows, or frankly that the consumer is in love with in the world of health. It's open. Wide open.
It is brand new. Everyone does have incredible opportunities in this space. So how does our audience get in touch with your organization, and how do they join?
Everyone can check us out at www.joinleague.com, and you can sign up there to become one of our early access members or health professionals.
And everyone is listening to Health Tech Talk, and I have time for a couple more questions. So here's a question that all of our investor community and financial community that's listening to wants to know. So how does League make money?
Great question. So one of the things we do is we enable a consumer to book an appointment, whether it's a massage with a massage therapist, or a session with your nutritionist, or maybe it's some special sports medicine counseling session or an obesity screen. Whatever it is, the consumer can pay through the League service, whether they're using their credit card or their insurance. And as a part of that transaction, League takes a service fee that the health provider pays League for.
Awesome.
So no cost to the consumer. And in fact, if you think about it, the way these marketplaces work is the more price transparency there is, generally the better prices get.
That is awesome. I love it. Anytime I hear the consumer doesn't have to pay, I want to thank you very much for being on the show. Go to www.joinleague.com, find out more. I want to thank everyone for listening to Health Tech Talk on iHeartRadio. 640 WGST. I want to thank 1-800 Public Relations for all their media and public relations. I want to thank everyone who's helped us out, Rachel, John, Gene, Jeremy, and Scott, and everyone at Stream VPG. And we'll see you next week on Health Tech Talk